When disasters strike, there are organizations to assist, and the Volusia Community Organizations Active in Disaster, or COAD, is one that can really make a difference. Hi, and welcome to Volusia Magazine. I'm Amber Patterson. On today's show, we'll take a look at this new organization and the purpose it serves. And that's not all. It's that time of year again, time for the International Coastal Cleanup and Halifax Indian River Cleanup. They're both set for the same day and will fill you in on how you can get involved. And if you don't know what the ALS Ice Bucket Challenge is, well, social media is just not your thing. But that's okay, we'll tell you all about it. Community Information Director Dave Byron will sit down with his guest, Mike White, Director of Veteran Services. Those segments, news, and more coming right up on Volusia Magazine. Stay tuned. When disasters happen, neighbors and community organizations often want to reach out to help, but they're just not sure how to go about it. A new organization, Volusia Community Organizations Active in Disaster, or COAD, is organizing to fill that need. Frank Bruno, a COAD co-chair, explained the group's purpose.
The COAD does not receive any government funds, whether it be local, city, county, or federal. What we do is we coordinate our efforts to help people in the time of a disaster. We also prepare people for disaster time, and we show people how they can become more involved in protecting themselves and their neighbors and their community in a disaster.
The Volusia COAD is composed of all kinds of different kind of partnerships and groups, and individuals even, who have an interest in the safety and security of our county. Jim Judge, Director of Emergency Operations, explains.
And the COAD is so important to Volusia County and all over Volusia County in that should we have a disaster, they're able to respond and assist our citizens in getting back on their feet, because as you know, government is not able to go on to private property, where the COAD, the volunteers with the community organization Active in Disaster, is able to go on to private property, help the homeowners be able to get debris or whatever it might be over to the side of the road so we can get it removed. So absolutely an important part of our community preparedness, community response.
The general membership meets every other month, usually at the health department. However, the upcoming September 17th meeting is scheduled to be held from 2 to 4 p.m. at the county's Emergency Operations Center, 3825 Tiger Bay Road, Daytona Beach. All interested individuals and organizations are invited. More information about Volusia Community Organizations Active in Disaster can be found on their website at volusiacoad.org. Volusia County residents can think globally and clean up locally during the International Coastal Cleanup and Halifax Indian River Cleanup. They're both set for 8 to 10:30 a.m. Saturday, September 20th. Volusia County's Environmental Management Division is looking for volunteers to remove trash from beaches, rivers, and parks during the double-header cleanups. Last year, nearly 650,000 volunteers in 92 countries collected more than 12 million pounds of ocean-bound garbage during the International Coastal Cleanup, which is sponsored by the Ocean Conservancy. Volusia County combines the coastal cleanup with the Halifax Indian River Cleanup to enhance the environmental impact. Last year, nearly 1,800 Volusia County volunteers collected more than 8,300 pounds of trash during the cleanups. According to Stacy Bell, the county's cleanup coordinator, trash in waterways is more than an eyesore.
We hold this event every year in partnership with the Ocean Conservancy because we know that trash is not just harmful to our wildlife and our natural habitats, but it's also a threat to our economy and tourism and really to the beautification of our county. Beaches and all of our coastlines are such important natural areas to our wildlife and to our citizens. Nobody wants to go down and sit down at the beach and be next to a pile of cigarette butts and straws. And those are the two most collected items during this cleanup event.
Volunteers can register online at volusia.org/cleanup through Wednesday, September 10th. Participants are asked to bring garden gloves, drinking water, and buckets or used plastic shopping bags. Participants are advised to wear a hat, sunscreen, comfortable clothing, and outdoor footwear. 19 official cleanup sites are designated from Ormond by the Sea to Oak Hill, but large groups of volunteers can arrange for a private cleanup location. Some river locations have boat launches where participants can bring kayaks, paddleboards, canoes, or motorboats to access hard-to-reach coastlines. For more information, you can go to volusia.org/cleanup. A social media fundraising movement geared towards raising awareness of ALS, also known as Lou Gehrig's disease, is having huge impacts all over the world. In just 1 month's time, from July 29th to August 29th this year, the ALS Foundation has received more than $100 million compared with the $2.7 million donated during the same period of last year. Millions of people have taken the challenge, including celebrities, former presidents, and even elected officials of Volusia County. The challenge requires participants like Sheriff Ben Johnson and property appraiser Morgan Gilreath to pour a bucket of ice water on their heads and challenge 3 more people to take the challenge within 24 hours or donate $100.
ALS is not a well-known disease, so I think increasing awareness of it may sound like the line on this thing, but it really is something that's a good thing. And I was amazed in our own department how many people. I mentioned earlier that we had over $500 raised in my department this morning by employees, and it's a hard time for everybody financially, so it really was good, and I was proud to do it, and I'm looking forward to seeing Jason Davis and the county council step up to the plate and get wet.
Thank you very much.
The property appraiser was nominated by County Manager Jim Deneen, who had been challenged by Volusia County Sheriff Ben Johnson. For more information on ALS, you can visit www.alsa.org.
Hello, I'm Volusia County Sheriff Ben Johnson with an important public service announcement. Don't risk your life and the lives of others by texting and driving. Put the phone down or safely pull over. Looking down for 1 second is all it takes. Is it really worth it?
Let's join health reporter Stephanie Strong for this message from the Volusia County Health Department.
Folks flock to Florida beaches for loads of fun on land and in the water.
Unfortunately, at the beach, there's not a lot of trees or shade, so we're exposed to the sun. So it's important to bring your umbrella, bring your sunglasses, bring your sunscreen, and protect yourself from the damaging effects of the sun.
Beachgoers should remember to use sunscreen, stay hydrated, practice water safety, and be respectful and aware of the animals and organisms that call our coast home. Sunscreen. Sunscreen with an SPF of at least 15 is recommended. When going outside, apply a liberal amount of sunscreen to all exposed skin, even on cloudy days. Remember to reapply sunscreen to your skin when outdoors for more than 2 hours and after swimming, sweating, or toweling off. Stay hydrated. Drink plenty of water when outdoors, especially in the summer heat. Pack bottled water when visiting the beach. Be mindful of the signs of dehydration, and that's dry mouth, dizziness, lack of sweating, dry skin, low blood pressure, rapid heartbeat, and fatigue. Water safety. Pay attention to weather and water conditions such as rip currents. Designate a water watcher to supervise children playing in and around the water. Learn CPR. Learning CPR empowers you to make a difference and save a life.
And of course, there's always water safety. We love the water as well. And in our beach, we have not only the nice sand and sand dunes, but the water can be deep, so children need to be always supervised because they can step into a hole and drown. Obviously, folks who are surfing, folks who are doing waterboarding have to be careful of the rip currents and any kind of hazards in the water.
You should also be respectful of our wildlife. Many animals call Florida's beaches and coast home. Many animals, such as sea turtles, rely on responsible human behaviors to survive. For Volusia Magazine, I'm Stephanie Strong, Public Information Officer for the Florida Department of Health in Volusia County.
For more information about this and other health-related issues, you can log on to volusiahealth.com. All summer long, our residential horticultural specialist, Joe Sewards, has been giving us tips on the 9 principles of Florida-friendly landscaping. Today, he wraps up the series with tips on preventing stormwater runoff and protecting our waterways.
Hi, this is Joe Sewards, and welcome to Horticulture Today. In previous episodes, we've been covering each of the 9 principles of Florida-friendly landscaping. To quickly recap, they are right plant, right place, watering efficiently, fertilizing appropriately, managing landscape pests responsibly, attracting wildlife, mulching, recycling, and today we're going to talk about the final 2 principles, which are reducing stormwater runoff and protecting the waterfront. One easy and simple and inexpensive way to reduce stormwater runoff on your property is simply install 1 or more rain barrels. They're easy to make, they're inexpensive. You can buy them online or in garden stores as well, or you can make your own. You simply get a food grade plastic barrel like this, you drill a hole in the bottom to accommodate a spigot, you drill a hole in the top to accommodate a downspout or anywhere that there's runoff coming off of your roof, and you capture as much rainwater as you can. That water can be used to hand water vegetables, container plants, small areas in your landscape. You'd be amazed at how much water will come off of your roof. 1 inch of water over 1,000 square feet is 624 gallons of water. So it doesn't take long to fill 1 rain barrel. So I recommend hooking them up in series or having a series of rain barrels around your house. Anybody can have a rain barrel. Some homeowners associations won't let you put them in the front yard, but you can put them in the backyard. We've had this rain barrel underneath the roof of this garage here for a while now, and it's been capturing a tremendous amount of rainwater. And as you can see, when you elevate it, that makes it easy to get a bucket or a watering pitcher underneath this so that you can then take it off and carry it to your patio or wherever you have container plants growing in the landscape. Because we like to keep our landscapes green and growing, we apply fertilizers and pesticides from time to time. Anytime it rains, a portion of those fertilizers and pesticides will wash off the landscape into the storm drain. That storm drain then leads to a detention pond or some body of water in your neighborhood, which in turn leads to either the St. Johns River if you live in the western part of Volusia County, or it'll lead to the Mosquito Lagoon and the Atlantic Ocean if you live in the east part of the county. So by learning how to reduce stormwater runoff, you are also helping to protect the waterfront by keeping excess water, nutrients, pesticides on your property and allowing nature the opportunity to filter them out of the environment before they make it to these precious bodies of water that surround us. Another way to reduce stormwater runoff and protect the waterfront at the same time is by creating a small rain garden. As you can see here, part of our new landscape here at the Extension Office is going to be capturing the rainwater in this small rain garden that's coming off the roof of the Extension Office. We've put up gutters. We're going to plumb those gutters underneath the sidewalk and have a pop-up in the middle of the rain garden. So every time it rains, that water will fill this small pool. That pool will then soak into the ground and eliminate any runoff coming from this part of the landscape. If you need more information about Florida-friendly landscaping and the 9 principles, you can call us here. We have special educational opportunities for homeowners, homeowners associations, condominiums, anybody who wants to learn about Florida-friendly landscaping. For Horticulture Today, I'm Joe Sewards. feel free to call us at the University of Florida Volusia County Extension Office, or you can visit our website as well. The phone number is area code 386-822-5778, or you can go to volusia.org/extension.
Time now to head into the studio to join Community Information Director Dave Byron for an in-depth discussion with his guest, Veteran Services Director Mike White.
Thanks, Amber, and hi, everyone. You know, with more than 75,000 military veterans living right here in Volusia County, the wants and needs of our veterans are a major priority for Volusia County government. The well-publicized recent delays at VA medical facilities and paperwork processing snags have prompted Congress to up the funding for veterans health care and make some rule changes that hopefully will improve this picture. Today we'll get a look at the health care situation in Volusia County for our local veterans, and we're pleased to have with us in the studio the county's Veteran Services Director, Mike White. Mike, how you doing?
Good, Dave. Yourself?
I'm fine, Mike. Thanks for being with us.
Sure.
You know, normally we have you in the studio right around Veterans Day. We've sort of advanced that a little bit this year because of really some well-publicized problems that came to the surface with some of our veterans facilities across the country, and veterans not getting the services they need and so forth. So we want to talk about those. But before we do that, Mike, I said there are about 75,000 veterans living in Volusia County. Is that about the number?
It's a very good number. We have veterans, we have the active duty, the Guard, the Reserve, and the dependents of those veterans. 75,000 is a good number, and that's a lot of people to handle.
You know, and pretty soon, Mike, I think you've told me in the past that Florida might be #1 for the number of veterans living here.
That's true. It's with the recent demobilization of Iraq and Afghanistan, there's more coming back. So between California and ourselves, we're fighting it out yet.
You know, it doesn't come as any surprise, Mike, that when you ask veterans like you do every day what their #1 focus point is, their #1 concern, healthcare comes right to the top, and that's not surprising, I wouldn't think.
Not surprising at all. Healthcare is the issue. It matters not if you're a World War II veteran or if you're coming back from Afghanistan right now and you're a week back and they want to know about their health benefits, how they get in, what has taken place, and how we can help them.
Obviously, there was some very well-publicized problems, negatives, if you will, at some of the VA facilities. The facility in Phoenix, I think, was the poster child, and that prompted dialogue across the country. Congress got involved. From your perspective as the Veterans Director for Volusia County, as you looked at the national landscape, how do you describe those problems?
The Veterans Administration, whether it's health, or comp and pension, educational, whatever the division is a huge bureaucracy.
Right.
And bureaucracies do not change overnight.
Right.
Things just do not happen unless somebody gets out there and does something. Well, there was a cap on how long it took for somebody to get in to see a doctor or have an operation or something. And they started keeping secret lists so that every time they reported to the Secretary of Veterans Affairs, they would always report back that they're doing good.
Right.
And that wasn't true.
Reporting that, you know, the time it took for veterans to get in to be seen and that sort of thing really wasn't as accurate as it should have been.
No, it wasn't. No.
Mike, you know, here in Florida, I'm not sure that we heard much about those problems locally. I mean, what's your perspective if Florida seems to not be so caught up in this?
And that's true, especially our catchment area, if you will. Florida and Central Florida in itself, Volusia County, our veterans, we did not see that.
Right.
You and I had talked many times, and we heard rumbles about different things going on. And I have constant conversations with directors of both the VA outpatient clinic in Daytona Beach, the director, Tim Lazert, down in Orlando. We have MAC meetings, we talk about it, and we had some glitches,
right,
but nothing to even compare to what happened in Phoenix.
Well, that's the good story. You know, so Congress, rightfully so, I guess, responded with some additional dollars for the VA and some rule changes and so forth, all designed, I think, to smooth out some of these problems. Because, I mean, heavens knows, Mike, I mean, we don't want any of our veterans to go without proper care. So what changes has Congress made as you understand it?
Wow. I can tell you, being that a legislative person for the County Veteran Service Officers Association and some other organizations I belong to, that I've sat with Secretary Shinseki, I've sat with Chairman Miller and a lot of the senators and congressmen in DC and talked about a lot of these issues and got some very good results from their getting together. This is prior to what was happening in Phoenix. Once Phoenix happened, the phones don't stop ringing.
Right, absolutely.
And why are we so well off? Why did we not fall in to that trap? Very simple. We did our stuff and we did it right. We have VA outpatient clinics in Orange City, in Daytona Beach. We have rehabs in Port Orange. We have all these different VA facilities. We have a brand new mental health pavilion. It's called the West Pavilion in Daytona Beach, strictly for mental health and rehabilitation and things of that nature. We have legislated, we've gone forward, we have worked hard to get these different facilities and everything here.
Well, Mike, it seems from what I read and what I saw on television that the concern, for the most part, was the time it took for veterans to get in and get care.
Sure.
You know, long waits, couldn't get in, even in emergent situations. As a result of the actions taken by Congress, I mean, have you seen improvements?
Yes, very much so. When you start throwing $13 billion around, and for this project, and $5 million for this, and whether it's homeless veterans, whether it's health care, access to health care, allowing the VA to go outsource doctors, private doctors, to handle certain veterans. That is big because that's not the VA's way. They've had a process they call fee processing, or fee basis, and they've had that for years, but not to the extent it is now. They want those numbers down, they want those veterans treated, they never want to have this happen again. So yes, they put a lot of money into it. Yes, it is happening left and right. Clients every day are telling me, I'm going to see a private doctor for this. I've got a C&P with a private doctor, and I've got, you know, different things that are going on in the system, just not health care.
Well, essentially, Mike, you know, obviously these are all complicated changes and so forth, but boil it down into essentially what has changed.
I think a mindset is probably the biggest thing I can tell you that has changed, is the mindset of what could happen if you don't get that veteran the access. The people, the unsung heroes that really didn't get recognized in this whole thing are all those VA employees that really care.
Right.
And they worked very hard and they didn't get their due. But what has really changed was money, programs, oversight, and just direct support.
Aren't there some time thresholds now that must be met? In other words, they have, you must be seen within a certain amount of time, or if something else happens? I mean,
the criteria was 30 days. That's always been the criteria, and that was a reporting criteria that they could not keep in Phoenix and other places. We fell outside the boundaries here and there on some of them, but it was we never fell outside the boundaries on critical care or our operations or things of that, where the other ones did.
Okay.
And that's the real key. They now prioritize and go through the entire triage process with every single veteran. Veterans are getting calls from the VA and say, look, we now have an opening earlier, would you like that one?
Right.
And giving them those opportunities. Would you like to go see a private doctor for it?
Mike, I know in your role as the Veterans Services Director for the county, what you guys do and your ladies do in your division is you process claims for veterans of all types. I mean, in other words, you help them get their benefits. And I know you've told me in the past that the veterans bureaucracy and the amount of work and that sort of thing, some of these claims could take months to work their way through the system. Have you seen, as a result of the profile here and this problem, have you seen that paperwork a little faster now?
Dave, and I know we've talked about some of it, but just in the last 6 months, the change, healthcare access, comp and pen, compensation and pension, VBMS, SHARE, MAPD, VACALS, these are all programs that county service officers wanted to have for a long time. We have them all.
Right.
We have virtual VA. We have everything that the VA people have there to process claims. They changed the law on processing of claims, how to do it. 18 to 24 months If you file a claim, and usually for those veterans who file your own claim out there and you don't know what you're doing, you're going to see 18 to 24 months. Come to us. I'm getting them in 3 to 6 months.
That's awesome, Mike.
That is not the exception to the rule. That's every day.
That's awesome. That's a significant change.
They changed the policy on fully developed claims and express. It's really nice.
You know, Mike, I know you've been a champion for the new significant hospital in Orlando.
Oh, yes.
It's been under construction for quite some time. It's probably going to be the showcase in the country.
It will.
What's the status of that? Is it open now?
Yeah, we've taken control of many of the buildings out there, and just the main building itself we haven't taken control of yet.
Mm-hmm.
Yes, some of the facilities are being used out there and being used very slowly to integrate people. Got to get the people and the computers in and test the lights and all that. It's coming along very well. I have a MAC meeting coming up, I believe, in 2 weeks. That's the board I sit on representing the county. And we get a lot of good information.
From your understanding, when is that facility supposed to be fully operational?
2015, and if I said April, I think I'm close. I'm not sure.
Okay.
Somewhere in that time frame. There's
Okay.
always last minute things.
You mentioned, Mike, that if there are veterans out there that are filing their own claims, it's a complicated process.
It is.
And your advice always is they need to come in and see you. You guys know the ins and outs, the rules and regulations. So tell us what you do for veterans and where they should go if they need help.
We file claims, benefits, we do appeals, we do it all for the veterans. Everything.
And their spouses.
And their spouses.
Right.
We can educate you, and all you have to do is come in and spend the time with us. Let us educate you. You make the decision. You want to go back to the computer and do all your own on the forms, more power to you. If you'd like us to do it, we'll do it for you for free. We haven't been the best county service officer in the last 10 years for no reason at all.
And you're doing what, about 16,000 claims a year?
Exactly.
Well, Mike, I want to thank you for sharing the information with us. For people that perhaps may want to get more information about you and your services, how do people get more information, Mike?
Easy, we go onto the county website and look under Veteran Services, and our web page is there. Call 386-740-5102. We can set you up in any of our 4 offices, DeLand, Daytona Beach, New Smyrna Beach, or our newest office in Orange City.
Well, Mike, I want to thank you for sharing the information. The news indeed appears to be positive, and that's good news for the 75,000 veterans living here in Volusia County.
Absolutely. Veterans are not a burden. They're our responsibility.
Absolutely. Our guest today, Mike White, the county's Veteran Services Director. And with that, we'll go back to you, Amber.
Thanks, Dave, and thank you too for watching Volusia Magazine. If you have any questions about the show, you can feel free to give us a call at any of the numbers you see listed here. Or you can log on to volusia.org and click on the News tab at the top of the screen to find us. Incidentally, you can find the County Council's meeting calendar there too. In fact, you can use volusia.org to find out about meeting dates, workshops, topics of interest, activities, and how you can become involved. And we hope you won't forget to listen to Volusia Today. That's Volusia County Government's weekly public radio broadcast. Volusia Today airs every Tuesday and Sunday mornings on the local radio stations you see on your screen. For Volusia Magazine, I'm Amber Patterson. Have a wonderful evening.